So today I was at dialysis and I found it super interesting because when you show up, they have to wear like isolation gowns, and usually they'll wear face shields too. But they'll have a nurse for 12 patients and a tech, and I think the techs had 4 patients, and they would help each other out. So something I learned today was the techs honestly do so much more work. They are the ones that actually connect the patient to the dialysis machine. They will inject their skin with lidocaine to make putting the access to or the needle in not hurt. They'll hang fluids. They'll check the blood pressure. They'll mess with the dialysis machine. They did so much, and at first I thought that the person I was following, the person I got assigned to, I thought she was the nurse for like 20 minutes, and then I realized that she was the tech. The nurse, they assess the patient by checking, auscultating the lung sounds, vital signs, ask if they've had any falls or haven't had any surgeries or anything like that, because they're on heparin for, to prevent clotting. And I always thought that dialysis was primarily just to filter blood, but you can actually filter blood and take off fluid. So that was really interesting, being that patients with kidney failure have like no urine output. They will weigh the patient. So the way it works is Monday, Wednesday, Friday is a typical schedule for a patient who has dialysis. Or they'll do Tuesday, Thursday, Friday. So on Monday, they'll have their treatment, and then they'll get weighed once their treatment's done. So then on Wednesday, they have to get weighed before their treatment, and the difference determines how much fluid they'll take off. So the patient came in and they, after their last treatment, they weighed 105, and they came back in on Wednesday and they weighed 111. That's a significant difference. So the machine will take that information and calculate how much fluid to take off, but it's really the nurse and the tech who decide, well, I don't really know that you can handle taking off 4. I don't even know what it was when they said 4, but taking off 4 amounts of fluid. So then they'll decide whether the patient can handle that, and we'll do a judgment call. And well, let's go for 3 today. I think you can handle 3. So I found that super interesting. I saw fistulas, catheters. They'll use like a 15 gauge needle primarily to access the fistulas. Before they do that, the tech will listen to the fistula, and I listened to it, and you can hear the bruit. It's like so obvious and loud, and you want to hear for that, swishing sound to make sure that the fistula is, working properly. So she said if you hear like a whistling, that means it's too narrow or something's compromised, and, they won't want to do treatment with that fistula. Another big thing is before the patient even, when they bring the patient back, before they even sit down, they put the blood pressure cuff on, and they'll take their blood pressure standing up. And if the blood pressure is too low, then they have to decide, well, you can't have treatment today, like your blood pressure is too low. So then they have to go home and try and come back the next day. So they will check blood pressure every 30 minutes, depending on the patient. Sometimes every 15 minutes they'll check, all the vital signs every 30. A big key for these patients is having a low phosphorus and low sodium diet. And yeah, I found the dynamic of care to be super interesting, being that the tech just did so much work. They do 16-hour shifts. The nurses do 4 10-hour shifts. And the nurse mentioned to me that the meds that they pass are like, it's like a list of 5 meds. It's not really that intense. And let's see what else. Yeah, I found it interesting just to see how much the techs were doing. I also found that the mental aspect of it to be interesting because, these patients are having to come in so much to get these treatments, and you can't travel like that. They said, I was like, well, can they travel? And it was like, well, you'd have to set up your treatment at another center, and, you'd have to be, approved there, and it's just this whole process. So it's like, man, it's got to be tough for them. This is something they do every week, a couple times a week, 3 times a week, and it's 2 hours, 3.5, sometimes 4 hours that they're out of their day, and then you just feel exhausted and like worn out. So I just found that to be pretty interesting. But other than that, it was a really good day. I learned a lot from the tech. The nurse was actually a brand new grad from Shasta College. She was super nice. They just have a really good dynamic there, and I felt like the patients all they know what they're doing. They know the flow. They know who's working there. They're clearly have been doing this for a minute. So, but I think the big things I took away was, dialysis isn't just filtering the blood, it's taking off fluid too. And these patients don't have any urine output. So you're having to hydrate them, but then you take that back when you're dialyzing them. And the amount of work the techs did was just shocking to me. And, it's definitely a informative, great clinical shift. Thank you.